Welcome to another episode from the Veterinary Medicine Digest. Today, we embark upon a comprehensive exploration of the frontiers of avian neurology, specifically focusing on the evolution of diagnostic imaging and the refined anatomical understanding necessary to perform high-risk procedures such as cisternal puncture in small avian species. To understand the significance of current advancements, we must first establish the foundational necessity of the avian neurologic examination. As outlined in the primary literature, a thorough understanding of basic avian neuroanatomy and physiology is the prerequisite for evaluating any abnormal function within the nervous system. The clinical objective is always to localize the anatomic distribution of neurologic disease, determine the severity of the dysfunction, and assess the prognosis for recovery. Traditionally, this began with a clinical examination integrated into a routine physical assessment, recording observations of mentation, posture, attitude, and gait. We have long understood that changes in the level of consciousness, such as obtundation or stupor, indicate functional damage to pathways mediated through the brainstem or diffuse damage to the cerebral cortex. The intricacies of avian posture and attitude provide a window into the central and peripheral nervous systems. For instance, the vestibular system, with its components in the cerebellum, brainstem, and inner ear, is responsible for maintaining the position of the eyes, head, and limbs relative to the body. Abnormalities such as nystagmus, head tilts, or compulsive circling are classic indicators of altered attitude, where central lesions may scramble output despite normal peripheral input. Furthermore, the evaluation of movement and gait allows us to assess coordination and strength, where a lack of finely tuned movement might suggest a lesion in the cerebrum. These clinical observations are vital, but they often lack the precision required for definitive diagnosis or for planning complex interventions. This brings us to the necessity of ancillary neurodiagnostic techniques, which have historically included survey radiography, cerebrospinal fluid analysis, diagnostic imaging, electrodiagnostics, and histopathology. Survey radiography, while being inexpensive and non-invasive, often serves as the initial screening tool, particularly in cases of trauma to the skull or axial skeleton. However, its utility is significantly limited by bony superimposition and low contrast resolution when investigating soft tissue diseases of the brain and spinal cord. For decades, clinicians have recognized that advanced cross-sectional imaging modalities, such as computed tomography and magnetic resonance imaging, are the superior choices for the evaluation of the central nervous system because they provide high contrast resolution and prevent the superimposition of anatomic structures. Despite their benefits, the adoption of these technologies in avian medicine has been slower than in companion animal practice due to the small dimensions of the avian head, limited spatial resolution, and significant anesthetic risks. The risks associated with anesthesia in birds cannot be overstated. Research indicates that birds have a high mortality rate during and after anesthesia compared to dogs and cats, with parrots showing a mortality rate significantly higher than their feline or canine counterparts. This susceptibility is linked to several physiological factors, including the unique structure of the avian respiratory system, which possesses a long and wide trachea with considerable dead space and a limited functional residual lung volume. Even short periods of apnea can be catastrophic. Furthermore, the stress of manual restraint required for induction can lead to an immediate activation of the sympathetic nervous system, sensitizing the myocardium to catecholamine-induced cardiac arrhythmias. Consequently, there has been a significant push toward procedural sedation, which can lower morbidity and mortality rates compared to inhalation anesthesia alone. In cockatiels, the intranasal administration of midazolam and a midazolam-butorphanol combination has been shown to provide safe and effective sedation, with the latter resulting in a deeper plane of sedation and fewer instances of vigorous struggling during restraint. This context of rigorous clinical examination and high anesthetic risk sets the stage for our featured research article, which investigates the structural changes in the Cisterna Magna region associated with cervical flexion in cockatiels. This study, led by Katsuno and colleagues, addresses a critical gap in avian neurodiagnostics: the safety and feasibility of cisternal puncture in small birds. Cisternal puncture is a widely used technique in mammals for collecting cerebrospinal fluid and for the targeted delivery of therapeutic agents to the central nervous system. However, it is rarely performed in birds due to the anatomical challenges and the high risk of iatrogenic injury. The cerebellomedullary cistern, or Cisterna magna, is exceptionally small in birds and is located ventrally near an extensive venous plexus, making the procedure a high-risk endeavor where the procedural margin for accuracy is minimal. The objective of the Katsuno study was to evaluate the morphology of the Cisterna magna in cockatiels using computed tomography and magnetic resonance imaging, specifically focusing on how cervical flexion and necessary positioning adjustment alters the anatomy of the region. To achieve this, 6 healthy cockatiels were used, with weights ranging from 90 to 107 grams. The birds underwent a sedation protocol involving the intranasal administration of midazolam, butorphanol, and dexmedetomidine with supplemental inhalation anesthesia as required to achieve the immobilization isolation necessary for high-quality imaging. The study successfully demonstrated that advanced imaging could be performed on sedated cockatiels with no adverse outcomes, identifying essential bony landmarks and soft tissue structures. The results obtained through computed tomography were particularly illuminating regarding the skeletal changes at the atlanto-occipital joint. The researchers measured the distance and angle between the atlas and the occipital bone at 4 different cervical flexion angles: 0, 30, 60, and 90 degrees. They found that as the cervical flexion angle increased to 90 degrees, there was a significant increase in both the distance and the angle between these two bones. Specifically, the median distance between the atlas and the occipital bone increased from 1.93 mm in the extended position to 3.09 mm in the flexed position. The angle formed between these structures also increased from approximately 80 degrees to 150 degrees. These findings suggest that substantial cervical flexion creates a larger gap, which may facilitate a safer needle insertion path for cisternal puncture. The magnetic resonance imaging portion of the study focused on the soft tissue changes using T2 weighted sequences to enhance the contrast of the cerebrospinal fluid. In one individual where sufficient cervical flexion was achieved, the magnetic resonance imaging revealed a dramatic expansion of the Cisterna Magna cross-sectional area, increasing from 0.88 square millimeters in the extended position to 3.42 square millimeters in the flexed position. Additionally, the depth of the Cisterna Magna increased from 1.60 millimeters to 4.15 millimeters. This suggests that cervical flexion not only opens the bony passage but also likely facilitates an expansion of the cistern itself, potentially due to the stretching of soft tissue structures and changes in cerebrospinal fluid dynamics. This increase in area and depth provides a larger target for the clinician, thereby reducing the risk of puncturing the underlying medulla oblongata or the adjacent venous plexus. However, the study also highlighted several challenges. While the 90-degree flexion angle provided the most significant anatomical advantages, it was not without physiological cost. One bird exhibited a decrease in peripheral oxygen saturation during this extreme flexion, highlighting the potential for respiratory depression or tracheal displacement. Furthermore, achieving the precise 90-degree flexion was difficult in several birds. Sufficient flexion at the atlanto-occipital joint was not achieved, leading to minimal changes in the measured areas. This underscores the difficulty of positioning small birds with highly flexible cervical spines and limited body size. The authors recommend that when precise positioning is critical, clinicians should consider early endotracheal intubation and continuous physiological monitoring to ensure safety. Building upon these findings, we can discuss the broader implications for avian neurology. The ability to safely collect and analyze cerebrospinal fluid in birds could significantly advance the diagnosis of neurological diseases such as viral encephalitis and meningitis. Historically, cerebrospinal fluid collection in birds has been considered difficult due to the narrow subarachnoid space and the presence of large venous sinuses that can cause significant hemorrhage if the approach is not perfectly centered on the midline. Early studies in pigeons utilized the atlanto-occipital space for cisternal puncture, requiring a well-aligned, laterally recumbent patient and a very controlled needle advancement at 1 mm intervals. The Katsuno study refines this by suggesting a ventral flexion approach at 90 degrees and providing quantitative data on the expanded margins for needle placement. These imaging advancements also complement older techniques like myelography. Myelography, the radiographic examination of the spinal cord following the injection of a contrast medium like iohexol, has been used to identify locations of spinal cord compression or swelling. In pigeons, myelograms obtained through injection into the cerebellomedullary cistern showed uninterrupted columns of contrast extending from the first cervical vertebra to the mid-cervical region. While myelography is cost-effective and useful, it remains a technique that requires accessing the very same high-risk area discussed in the cockatiel study. The detailed anatomical atlases provided by modern computed tomography and magnetic resonance imaging can only serve to make such contrast studies safer and more accurate. The discussion of avian neurodiagnostics is further enriched by the application of ultra-high field magnetic resonance imaging. Recent cadaveric studies using 3.0 Tesla magnetic resonance imaging systems have provided exquisite detail of the central nervous system in birds of prey. These high-resolution images have allowed for the identification of delicate structures such as the olfactory bulbs, the hypopallium, the idencephalon, the optic lobe, and various cranial nerves including the trigeminal and facial nerves. Such detailed anatomical mapping is crucial because it allows clinicians to distinguish between normal variation and subtle pathologic changes that might be missed on lower field systems. For example, the differentiation between grey and white matter in the spinal cord and the visualization of the unique avian glycogen body are now possible with high field imaging. When we synthesize all these perspectives, it becomes clear that avian neurology is moving toward a more sophisticated imaging-led discipline. We have progressed from relying solely on clinical observations of gait and mentation to using high-resolution computed tomography and magnetic resonance imaging to plan and execute high-risk procedures like sternal puncture. The Katsuno study provides a vital piece of the puzzle by quantifying the anatomical benefits of cervical flexion in cockatiels, suggesting a 90-degree angle as the optimal position for maximizing the procedural margin. This evidence-based approach to positioning, combined with the safety benefits of refined sedation protocols, represents a significant step forward in avian medicine. In conclusion, while the anatomical constraints and anesthetic risks in birds remain substantial, our growing understanding of neuroanatomy and the application of advanced imaging are paving the way for safer and more effective diagnostics and treatments. Clinicians must continue to integrate thorough neurologic examinations with the most advanced tools available, always mindful of the species-specific physiological responses to stress and anesthesia. The goal is not merely to observe, but to accurately localize, characterize, and ultimately treat the neurological disorders that affect these unique and complex patients. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.